Stein with today's Ask the Doctor segment.
Knee replacements can require more downtime than most of us would like. With new techniques, that downtime in some cases can be minimized. Dr. Charles Stewart of Boca Raton Regional Hospital joins us this afternoon to answer your questions about post-operative care for knee replacement patients. Thank you so much for joining us. Now, last week, we talked about patient-specific instruments and how they've helped in the procedure in conducting the knee replacement surgery. But how does that impact recovery?
Well, what's most important is that we have many techniques now for minimizing the pain after surgery, and that's the most important thing. We realize that we need a good implant, we need good instruments, but we really need pain control, because without pain control, the rehabilitation is very much difficult, and that's what we want to minimize.
So patient-specific instruments won't really minimize the pain control. No. But the downtime is still minimized in many cases now with knee replacement surgery.
Absolutely. We really have a rapid mobilization protocol. What that means is people are up walking the same day. You use a walker initially, but you're up on it. You can put all your weight right away on it.
But how painful is that?
Well, we use nerve blocks. So the first 48 hours, people have very little pain. Afterwards, some have modest amounts, some have a lot, some have minimal.
You have to ease into it.
Exactly.
How long are they in the hospital?
For the younger patients, defined as under 65, 2 days. For the older patients, 3 days. Probably 80% of people go home now. That's been a big switch. Used to be everybody went to rehabilitation centers, but we realized the best place for you is home in your own bed if you have someone there with you.
How long do they stay on medication usually?
Well, some people are on it for 2 weeks, some for 2 months. It depends on their pain level. And truthfully, the biggest problem has been bleeding in artificial joints. And we do a lot of things now to minimize the bleeding, because the more it bleeds, the more it hurts and swells.
Oh, really?
Yes.
Okay, so how do you do that? And how do you know if you're going to have a problem with that?
Yeah, you don't always know. We have a lot of techniques now. We use some intravenous medications to minimize bleeding. We have a new device we use to stop bleeding in the joint itself. There's certain sprays we use to minimize bleeding. So a lot of techniques we use to minimize that.
I wouldn't think diet is a big deal with knee replacement surgery, but you find out more and more that it really does play a role in about everything we do.
Well, certainly good nutrition is important for wound healing, and as well as for energy levels, so that's an important part, absolutely.
How long after knee replacement surgery is someone usually back to feeling like their normal self?
It's usually about 3 months before I tell people they want to take a cruise or go on a trip. Most people, if they're in their 50s and 60s, are back at work within a month. But 3 months before you feel like playing golf, before you really say, thanks very much, I'm a new man now.
Let's go back to the very beginning of talking even about knee replacement surgery. What are some of the symptoms? When does someone know the knee is really shot and you can no longer just do a few injections to eliminate the pain?
I think the major thing is if you're not sleeping at night. If you can't get a good night's sleep, I think doctors have minimized the power of restorative sleep. And when you can't sleep, that's when you need to have something done. But also importantly is that when your level of activity is decreased so that you can't do what you want to do. For some people that's tennis, some people that's visiting their grandchildren. So I think it's a matter of how much can you tolerate. As we get older, we all decrease our activity to some level. But at some point you say, enough's enough, I don't want to live like this.
All right, thanks. We'll let that be the final word,
Thanks
Dr.
very much.
Stewart.
Good
Thank
afternoon.
you so much. Boca Raton Regional Hospital sponsors our expert and also underwrites our Ask the Doctor segment. We're back with more in just a moment.